Good afternoon, Associate Professor Dr. Ganesan Naidu.
Hi.
Hi. As far as we're concerned, Raffles Hospital is one of the leading healthcare hospital in Singapore as well as in Asia Pacific. There are many Vietnamese patients choosing Raffles for the treatments. So could you kindly share with us what are the strengths of Raffles hospitals as well as your specialization and expertise?
Raffles Hospital has always been a healthcare provider of choice for many Singaporeans and foreign patients because of the expertise and wide range of clinical specialities. In addition, the unique feature of Raffles Hospital is the group practice model. This means the patient is the center of attention. Several specialists can care for one patient who may have other medical conditions. We can access the patient's medical records with ease. This translates to less investigations being performed and thus less cost to the patient. This is not available in any other hospital, private hospital in Singapore. Equally important is the quality of the Raffles staff. This includes the doctors, the nurses, and non-medical employees. They are friendly, caring, and go out of their way to the patients to make them feel at home. Raffles is also the only private hospital that is trusted by the Singapore government to treat the civil defense ambulance cases. These are complicated and often severe cases. They require a team approach and a high level of expertise. This is what I was saying about the level of professional care that Raffles can provide. I'm an orthopedic surgeon of 15 years. I'm specialized in trauma and fractures, limb reconstruction, such as total elbow, total hips, and total knees, and also sports surgery, such as torn ligaments of the knee and ankle. I also specialize in hand surgery.
As per your treatment experience for more than 1,500 cases, could you kindly share with us what are the advice for the patients before and after the treatments at Raffles Hospital?
Before the patient comes to the Raffles Hospital, please contact the Raffles representative office or the Raffles clinic. They will assess you and provide the specialist in Singapore with important information to make your treatment more focused and seamless. We can even fix dates for surgery before you leave Vietnam if that is required. We hope that after the treatment at Raffles Hospital, you will be recovering well and at peace of mind that you have been given the best possible medical care in the world.
Talking about your expertise at sport trauma, could you share with us what are the common types of sport trauma-related medical problems and what are the high-tech treatment options at Raffles Hospital?
This depends on the most popular sports in the region or country that you are talking about. For example, in Singapore, soccer and football is common. We see patients with ligament, cartilage, and meniscus tears in this group of patients. Basketball is also common. We see patients with shoulder dislocation and labrum tears. All these require surgery if you want to return to the same activity level and before the injury. In Raffles, our surgeons are experts in treating these injuries by using keyhole surgery. This leaves little or no scar. At the same time, we can do what is required to treat the condition.
As far as we've known, you have done many operations for patients from Singapore, from Indonesia, from Vietnam, and they have the very severe trauma such as ACL tear, PCL tear, or broken patella. So could you tell us what are your experience as well as treatment plans when doing the surgery for them, and how long will they return to their normal activities?
Treatment of sports and related injuries that you mentioned above are one of my specialities and interests. I find these athletes are very motivated to recover after surgery. This makes the return to sports much quicker. I always say that 50% of the success of such surgery is in the hand of the surgeon. The other 50% is up to the patient. If the patient is lazy and does not do physiotherapy, then recovery will be long and painful. Usually it takes about 4 to 6 months to return to the normal activities.
So, what are the best ways for the patient to prevent or to avoid these injuries?
The best way to avoid injury is to be fit and take care when performing the sport. Training is very important, and so is good food intake with balanced diet and enough sleep.
There is a new surgery method for knee replacement, which has been applied very successful all over the world, which is minimal invasive knee surgery. So, could you tell us what are the advantages of this method?
Minimally invasive surgery means doing the job with the smallest incision. This speeds up recovery, that is a shorter hospital stay, and you experience less pain after surgery. Most of the surgeries are performed in this way, not only in orthopedics, such as arthroscopy in the joint and thorax and abdomen. We commonly practice this at Raffles. The patient is able to stand the next day after knee replacement surgery, and by the 4th day after surgery, she or he is able to walk out of the hospital after discharge. Of course, with a walking aid for 3 to 4 weeks. After that, they are walking almost normally with no or minimal pain. They can go for holidays after 3 months. This is the advantage of minimally invasive surgery.
We knew that you are great expertise as artificial knee replacement surgery. We have some old patients who have like chronic knee degeneration disease, and they also have the other problems such as high blood pressures and diabetes. So they are scared of undergoing a surgery. So according to your experience, could they do the artificial knee replacement surgery? And how long can they walk normally after the operation?
Artificial knee surgery and hip surgery has become a fairly common operation in this day and age. Patients are getting older and have more medical problems, as you have mentioned above. We do a thorough medical evaluation before we consider surgery. We even screen their hearts and their lungs. Surgery is only performed, all these medical conditions are well controlled and do not pose a threat to the operation. Most of my patients have such conditions. With medical expertise and group practice model, I can get the green light for surgery in a very short time. I have not had any major complications with this type of practice. As mentioned above, patients normally walk on the 2nd day after surgery, and by 1 month, they are walking normally again.
Regarding the hip, we also have the patients who have the hip joint necrosis or hip joint degeneration, especially they are very, very young. So could you tell us what are the solutions for them?
The treatment depends on the severity of the condition. Early disease is usually treated with medication such as painkillers and walking aids. And the more severe conditions will require surgery, because the patient, being young, wants to return to his or her activity and sports level. Replacement surgery can achieve this to a certain extent. My patients have gone back to skiing, jogging, and even trekking and swimming. They are very happy, and so am I.
And finally, with over the years of your experience in treating for patients from many countries, do you have any remarks or special advices for Vietnamese patients?
I find that Vietnamese patients are always polite and courteous. They are very conscious about their health. They take my advice seriously. This makes it easier for me as a doctor, as the cooperation and respect between the patient and the doctor is very important in the healing of the disease and having a successful outcome for the patient.
Thank you, Dr. Ganesan Naidu, and wishing you a good health years ahead to continuously help our Raffles Hospital patients as well as Vietnamese patients. Thank you.
Thank you very much.